What disease did Kris Kristofferson have? The diagnosis that changed everything. This is part of a Common Sense Lyme disease series. I'm Dr. Cameron. I discuss cases that I've seen, questions that have come up in my practice. So let's begin. Now, Kris Kristofferson suffered from memory loss, confusion, fatigue, and word finding. He was initially thought to have Alzheimer's and was suspected to have Parkinson's disease. This is over 10 years ago. He had been at the peak of his career, and with the Alzheimer's and possible Parkinson's, he was not able to continue his career as well as his life with his family. His wife, Kris Kristofferson, questioned the Alzheimer's diagnosis, sought various medical opinions. Now, this often happens that there's different diagnoses, multiple doctors, multiple meaningful advice, but he remained sick. So at some point, they ordered a Lyme disease test. The test came back positive. Now, this is from Rolling Stone, so it's not from a journal, but there's other articles that discuss the same topic. He was given a diagnosis of dementia, but Lyme disease can mimic dementia. It can have cognitive problems, mood changes, motor dysfunction, and psychiatric symptoms. And I see that in my practice. Chronic neurologic Lyme disease had many of these same characteristics. It was described in 1990 by Drs. Legigian, Steer, and Kaplan. I continue to see that in my practice. Now, Lyme disease can be mistaken for not just Alzheimer's and dementia. There's Parkinson's, depression, and a whole range of other issues. So treatment changed everything for Kris Kristofferson. He started antibiotics. He had dramatic improvements. His memory and confusion came back. He had renewed energy. All of a sudden, he was back, according to his wife. Treatment changed everything for him. He was able to have dramatic improvements. He had memory concentration that improved. His memory allowed him to begin to write. He was active out with the community. His wife said all of a sudden he was back. Why Lyme disease can be misdiagnosed? Probably most people know this already, but the symptoms overlap with other conditions, so it's easy to call it another condition. For example, they might call it fibromyalgia or anxiety disorder, OCD, POTS, whatever diagnosis comes along. Lyme disease doesn't always show up on the list, or the test is negative. Lyme disease, this chronic type form of Lyme disease, is something the doctors are reluctant to discuss. Sometimes they'll call it post-treatment Lyme disease syndrome. In some cases, they don't even get that diagnosis. They'll just talk about Alzheimer's or some other diagnosis. Part of the problem is there's no tick bite that you can count on, a rash that you can count on, and the tests are not so good. So what we can learn from Kris Kristofferson's story is that you shouldn't settle for a diagnosis that doesn't fit. You should always ask about Lyme disease if there's cognitive problems, and be aware the tests are not that good, and they're not as reliable enough to replace your role as a doctor. And I would advocate for more comprehensive testing so we can have something to help us. Now, by the way, there is no blood test for Alzheimer's and dementia that we can count on either. That's a clinical diagnosis. Lyme is a clinical diagnosis. I didn't personally examine Kris Kristofferson, so I don't know any more details than what I can share with you. Now, this is part of a Common Sense Lyme series where I discuss case and answer questions. Appreciate you being here. Have a good day.